to pregnant and parenting women in the Child Assistance Program. Ashley.
Hello, everyone. My name is Ashley Pina. I am the Pregnant and Parenting Family Substance Use Disorder Policy Administrator in the Division of Behavioral Health and Recovery. I'm going to start the presentation this afternoon by sharing the proviso language that supports this combined effort to increase the number of substance use disorder treatment beds for pregnant and parenting women and parent and child assistance program, also known as PCAP, client slots. I will provide an overview of pregnant and parenting women's services, and my colleague, Sarah Pine, will cover PCAP services. Next slide, please. The funding provided on a phased-in basis to increase the number of PCAP case management slots by 56 and to increase the number of PPW, pregnant and parenting women, residential treatment beds by 16 in the year 2025. The outlook assumes an additional 32 pregnant and parenting women residential treatment beds are phased in through the year 2027. Next slide, please. Pregnant and parenting women's services are designed to meet the needs of pregnant and parenting women seeking services. Pregnant and parenting women are a priority population for the federal substance abuse block grant funding. PPW services include inpatient and outpatient substance use disorder treatment. Residential substance use disorder treatment is available to women and their children under the age of 6 for up to 6 months. Structured clinical services are provided in a planned regime of patient care in a 24-hour live-in setting. There are 8 PPW substance use disorder inpatient programs in Washington State, located in Snoqualmie, Yakima, Thurston, and Clark County. Next slide, please. The current status of this portion of the proviso starts with a procurement process. The procurement type is a request for information set to start in January. This is also known as a RFI. There's a potential for multiple contracts with this RFI. The audience for this procurement type is substance use disorder residential treatment providers. The procurement start month is January 2024 with the goal to have a provider identified by June 30th, 2024. This concludes my portion. I'll hand it over to my colleague, Sarah Pine, to provide an overview of PCAP services and her role in increasing PCAP client slots. Thank you so much.
Thank you, Ashley. I'm Sarah Pine. I'm using she, her pronouns, and I am the Pregnant and Parenting Women's Behavioral Health Program Manager with the P through 25 unit. I will be discussing the task on PCAP expansion identified in this budget. Next, oh, we're good on the slides. The Parent-Child Assistance Program, commonly known as PCAP, is a 3-year intensive case management program. There are currently 15 locations statewide, serving a total of 20 counties, and currently contracted to serve 1,490 clients. PCAP is funded by both Medicaid and state dollars. Next slide, please. PCAP assists clients in learning to access and use local resources that cater directly to each client's individual needs. This also includes receiving treatment, establishing recovery, and supporting parents with their child's individual needs as well. Next slide, please. DBHR and DCYF have a long-standing interagency agreement that has supported PCAP to serve DCYF-involved clients whose child receives a substance-affected newborn, SEN, diagnosis. There are 4 locations that have been identified as areas of high parent-child DCYF involvement with SEN diagnosis. These 4 sites are King, Yakima, Spokane, and Clallam-Jefferson. Each location currently dedicates 14 client slots for these families. Next slide, please. The current budget identifies $603,000 per fiscal year to double the capacity dedicated for DCYF-involved PCAP clients. This would be an addition of 56 client slots by the end of fiscal year 2025. We are currently partnering with the participating PCAP providers and DCYF to determine the expansion agreements. We estimate final agreements to be determined within the next 4 months.